Hi everyone, so we're going to cover chapter 12, which is on stress, adjustment, and health differences in personality. This chapter outlines relations among personality, stress, adjustment, and health, and understanding individuals in a real-world social context. Psychosomatic medicine is based on the idea that the psyche affects the soma, which means the mind and the body are connected. In the 1920s and 30s, many interesting ideas came about psychosomatic medicine directly out of the psychodynamic theorizing of Sigmund Freud. Historically, it was thought that concepts of unconscious inner conflict and struggle is what led to disease. Such ideas helped launch modern research on stress and illness, but they also produced many false starts, ambiguities, and the serious problem of unfairly blaming victims for their diseases. So a lot of research has studied how personality is related to illness and health. And so the psychoanalytic and neo-analytic explanations have faltered to be replaced by a variety of more scientific explanations. There are a number of ways in which personality has shown to be relevant to illness and health, but the relationship between the two is very complex because there's major pathways of the influence to illness. And so, for example, biological predispositions can affect personality, which can affect health behaviors, what people do. So, for example, there's biological predispositions to certain risk factors for illness. And then personality can contribute to your unhealthy habits, such as smoking and drinking, and physiological abnormalities, such as sensitivity to stress, which can impact the progression of a disease. And then you can have cultural expectations, such as the sick role, which can also influence the illness expression. And so there's multiple factors as to whether somebody develops a risk of an illness or not based on personality. And so the first major link between personality and health involves health behaviors. So, for example, people in unhealthy situations tend to be more impulsive, depressed, isolated, angry, and psychologically impaired, which can put them at higher risk for illness. It's also been shown that conscientiousness has been linked to healthier behaviors and predicts healthier situations. It's also a strong and reliable indicator of health and longevity. So why do situations have to do with personality traits? Well, they have to do with personality traits because people with certain personality characteristics may tend to seek out certain situations. Certain situations could put them at risk for an illness or a disease, depending on the situation. So, for example, someone who's more rebellious or more aggressive may tend to seek out peer groups or gangs that use drugs or ride fast motorcycles. An alienated teenager could find meaning in a religious peer group or a green political movement. And so situations can play a role in how we behave. So these particular personality characteristics that are associated with unhealthy behaviors can increase the risk for disease. People with problems in emotion regulation may seek a stimulating effect of cigarettes, alcohol, or illicit drugs in an attempt to change their physiologically based moods. Many unhealthy behaviors that place people at a high risk for medical problems can also be instigated by stress, and stress is likely to be a problem for impulsive and emotionally unstable people. People that are sensitive to stress or they're highly reactive can also react more and engage in unhealthier behaviors. So, for example, stressed individuals tend to eat more and gain excessive weight. And this is because the chronic stimulation of the hypothalamic pituitary adrenal axis is mediating this relationship between stress reactivity and the increased risk of medical problems. So over time, stress hormones, when they're constantly overactive, they can put wear and tear on the body and cause issues with immune function. So obesity, chronic stress, and chronic inflammation are involved in a variety of diseases. The sick role theory is a concept in medical sociology which states that someone who is suffering from an acute illness or chronic illness has a different set of rights and obligations than someone who is well. So, for example, the sick role is identified as a set of societal expectations about how you should behave when you are not healthy. And so, for example, if you're not healthy, you're expected to go see a doctor, stay home from work. You're also expected to be uncomfortable or in pain, avoid strenuous activity, and act a certain way. Sometimes people take on the sick role even though they are not physically sick or there's no known medical condition that can account for their activities. And so people who are under extreme stress or people that are not well adjusted to certain life circumstances, they may respond to the pressure of societal expectations or obligations by assuming the sick role. And so, for example, a person who's really stressed out by starting a new job may avoid this responsibility or they may call in sick, which these illness behaviors can lead to the person being defined as ill and everybody believing that they are ill. There are some studies that show neuroticism is related to identifying with the sick role. Many neurotic people tend to retreat to the safety of the sick role when they encounter challenges in their lives. In our society, it's considerably easier and more socially acceptable for a person to seek medical care from a doctor and to adopt the sick role than it is to seek psychological help for an emotional problem. So, for example, it's much more socially acceptable to call out of work and say we're sick because we have the flu or because we are not physically well than it is to call out sick and say that we are depressed. And so people that are under a lot of stress or they are psychologically impaired tend to take on the sick role as a way to avoid certain behaviors associated with obligations. Symptom perceptions are affected by the way the person attends to their bodily sensations. So the level at which a person is paying attention to their sensations and what they think about them can determine symptom perception. So for example, if people believe that fatigue is a symptom of illness, they're more likely to define themselves as sick when they experience fatigue. Whereas others who see fatigue as a normal part of everyday life, they're less likely to define themselves as ill when they experience fatigue. And so the interpretation of a bodily sensation as a symptom of illness is affected by perceptions. It's also affected by the person's mood and their chronic emotional state. So negative moods such as depression increase the likelihood of defining symptoms as indicative of illness. It's also been suggested that in many cases, symptom reporting is better regarded as an indication of neuroticism than as a sign of organic disease. And so in cases where there is no underlying organic disease or known medical cause for symptoms, sometimes the pain or symptoms a person's experiencing is in reality due to a psychophysiological reaction to stress. And so it's not that it's not real, but it's really the fact that people are responding in a very sensitive way to stress. And they're responding in this way because they're interpreting their symptoms as indicators of illness. And so the anxiety that's surrounding the fact that they may be sick and they're experiencing these symptoms because they're ill with something can, in fact, cause them to adopt the sick role. Behaviorists would actually argue that adopting the sick role is learned because it's rewarding. So, for example, when you get sick or you say to someone that you're sick, you may receive sick pay or days off or sympathy from friends. And so the sick role is exemplifying a behaviorist view that personality can be located in the environment. And so if somebody adopts a sick role as an escape from stress, it could be rewarded or positively reinforced. The link between personality and health is due to the fact that disease is affecting personality. And so you have disease-caused personality changes, which is also known as the somatopsychic effect, meaning that the body is affecting the mind. And so as the body deteriorates, the mind changes. And so take, for example, Alzheimer's disease. People with Alzheimer's disease experience memory loss. And so as their brain starts to deteriorate and they start to experience memory issues, they often experience changes in their emotional responses. And they may have less control over their feelings and how to express them. So, for example, they may overreact to things, have rapid mood changes, or feel irritable. They may also appear unusually distant or uninterested in things. And so over time, as the body affects the mind, disease can impact personality. There's also personality differences in health, which may begin before birth, and they may be influenced by genetic environmental interactions throughout life. The diathesis stress model is also known as the vulnerability stress model, and it's a psychological theory that attempts to explain a disorder or its trajectory as the result of an interaction between a predispositional vulnerability and stress caused by life experiences. So this theory is suggesting that mental disorders result from a combination of genetic risk factors interacting with environmental factors. This was based on Bernard Lowndes' insights that predisposition of the body to a disease or disorder can form based on the environment or a stressful situation that brings it out. Bernard focused on the emotional reactions of the individual and that stress relates to the recall of emotionally charged experiences, and such psychological stress is uniquely individual. All personality theories emphasize the importance of a healthy, sensible childhood to later adult mental and physical health. So in childhood, when there is severe stress, trauma, or child has a history of sexual or physical abuse, it places the individual at a much higher risk for having later problems with their mental and physical health in adulthood. And so that's where we can typically see the development of personality disorders. And personality disorders are usually stable by early adulthood and they last for many years. people suffering from them can't seem to fit well into their families or jobs, and there are regular significant disruptions, and these individuals can be excessively suspicious, exceptionally emotional, or markedly anxious. And so it isn't quite understood as to what exactly causes personality disorders, but we do know that severe stress in childhood is a significant risk for them. Borderline personality disorder is the term applied to people that have serious issues of emotion regulation. And so they tend to be impulsive, self-destructive, they have a fragile self-identity, and they tend to have moody and stormy relationships. And so these individuals can suddenly shift moods due to an unforeseeable event. And so they may shift the mood to very negative, and they may stay in that state for a very long time. They could make suicidal threats or attempts while feeling empty and struggling to avoid abandonment. They are very difficult to understand and treat because many of these disorders can't really be understood or treated from a single perspective. Research has linked stressful activity to the development of coronary heart disease, and personality psychologists have been interested in determining what causes a proneness to heart disease. What types of personalities could perhaps be linked to an increased risk of coronary heart events? So, based on a century ago, it was argued that heart disease was characteristic of those with repressed aggressive tendencies. Based on what we know now, there is a lot of evidence suggesting that people who lead confrontational, competitive, and driven lives are more likely to suffer from heart disease, not because it's that they're hardworking or they're having a challenging job or they're really driven to achieve things, but it's the fact that they have this hostile struggle that is the problem. And so, in other words, there's evidence that hostility specifically is linked to heart disease. There were two cardiologists that came up with the idea of a type A behavior pattern. And in their patients, some of them had this behavioral pattern of acting very hasty, impatient, and impulsive. And they believed that they were more prone to coronary events because of these traits associated with this drivenness, competitiveness, and hostility. And so the type A's were said to be hyper alert, potentially hostile, and this idea is what inspired several decades of intensive research on the idea of a coronary prone personality. So personality types, such as the type A behavior pattern, can be pretty misleading because you can't take a whole bunch of people and fit them into this type just because they might have, higher hostility or they might be more competitive or driven. And so you really have to understand people's health behaviors, coping strategies, and their processes in more detail rather than focusing on type A, type D, and so on and so forth. So, for example, individuals who are type A but who have high levels of neuroticism and low levels of agreeableness, they tend to be at higher risk for coronary heart disease because they tend to engage in unhealthier behaviors that help them cope with constant struggle. And so individuals that have high levels of distress who are not as agreeable or may want excessive control over situations may engage in unhealthy coping strategies in order to deal with those emotions and feelings. And so individuals may drink or smoke or overeat. They may lose sleep at night, or they may feel lonely or socially isolate themselves. And so all of these behaviors that they're doing are what are actually leading to the increased risk of coronary heart disease, not necessarily the type A behavior pattern or types of personalities. And so oftentimes it can be misleading to think of it like this. And so understanding the processes and the mechanisms in more detail that are associated with personality types can be very helpful in understanding why there might be a more personality prone disorder or a heart disease prone personality. So based on all the scientific work, researchers were interested in why some people are likely to become ill and others are not. And so they were interested in looking at the effects of emotional states on health problems. And so a meta-analysis was conducted, which is a statistical technique that combines results of various studies to see what they say when taken together. And so they found that there were significant associations between various psychological disturbances and several diseases, meaning that anger specifically was not tied to just one disease. There were some people that had anger, but that got asthma or headaches. And so various disturbances were tied to various diseases. So it wasn't the case that anxiety was related only to ulcers and repression was only related to asthma. And so there seemed to be evidence for what was known as a generic disease-prone personality. And so researchers were interested in what is exactly determining whether somebody gets sick or not, depending on the type of emotional states that they have and the emotional disturbances. And so some emotionally imbalanced people are living long, healthy lives, whereas some people are suffering these same emotional disturbances, but they're not getting sick. And so researchers were interested in what is determining this difference. And so in order to clarify and understand how personality is interacting with time and circumstances to affect health, it's necessary to follow large numbers of people throughout their lives, so over several years, and document their changes in personality and documenting some of the things that they are going through in order to really understand the interaction. And so this was done in the study of human termites, which was conducted by Lewis Terman. Lewis Terman was an intelligence researcher who studied bright California school children, and he looked at their intellectual development, and he ran a longitudinal study where he followed them into adulthood. And he collected their trait ratings from parents and teachers, and he ran a survival analysis where he developed 6 personality dimensions to predict longevity and causes of death. So he was interested in the types of aspects of personality that are related to longevity in general and to specific diseases in particular across the lifespan. Terman's longitudinal study showed that children, especially boys, who were rated by their parents and teachers as being prudent, conscientious, truthful, and free from vanity, lived significantly longer throughout the lifespan compared to their less conscientious counterparts. And so the study showed that characteristics involving conscientiousness were conducive to longevity. And this finding highlighted the fact that personality can predict survival across the lifespan. Characteristics of conscientious people are that they tend to engage in better health habits and in fewer risky activities, which could also explain the reason for why they may live longer. Conscientiousness has also shown to be protective against early death from cardiovascular disease and cancer. And so the mechanism that might explain this is that a conscientious personality leads people into much healthier situations and relationships. Sociability was another aspect of personality that Terman looked into, and he found no evidence that sociability was strongly and directly related to health and longevity. And it's because traits of sociability don't necessarily indicate good social ties or healthy relationships. Having good social relationships is healthy, but it may not necessarily mean that a person high on the trait of sociability is going to develop the best social ties. And so that's important to consider. Traits of impulsivity, egocentrism, and undependability tend to have health-relevant implications. Sociability is also an aspect of extroversion, and extroverts tend to be more attracted to social settings, but also risky situations where they can engage in unhealthier behavior, such as alcohol, smoking, risky sex, and risky driving. And so situations that a person enters need to be considered. To further explore the lifelong effects of sociability, there was Friedman who followed up on Terman's study of scientists. And Terman had found that termites who grew up to be scientists had much less sociability early in life than non-scientists. And in fact, Terman considered these differences in sociability to be remarkable because sociability did not necessarily mean that they lived longer. And so his groups and study was recreated by Friedman, and the survival analyses found that scientists did not die sooner even though they were less sociable. In fact, they tended to live longer. And so having a very sociable personality did not solely forecast a long life. And it's because highly sociable extroverts in American society are generally at a greater risk for smoking and alcohol abuse. And so it's really important to consider not only sociability, but the situations that one finds themselves in due to their personality characteristics of sociability and extroversion. Another characteristic was cheerfulness, which is rated optimism and a sense of humor. And according to Terman, he found that childhood cheerfulness was inversely related to longevity. And so cheerful kids grew up to be adults who died sooner. And so it seemed as if cheerfulness meant that children had lower survival rates as adults. And again, this might be because cheerfulness could indicate more extroversion, and extroverted people tend to be more likely to find themselves in riskier situations. These people grew up to be more likely to smoke, drink, and take risks, but these habits did not fully explain their increased risk of premature mortality. It might also be the case that cheerfulness is helpful when facing a stressful situation such as surgery, but harmful if it leads a person to be careless or carefree throughout their life. And so, in other words, people who behave in an amusing way are not necessarily those whose attitudes and behaviors are the most healthy. However, their optimism could mean more healthier behaviors. So an optimistic person that is facing health challenges may be more willing to cooperate with treatment or adhere to medications. And so this would be an example of the interaction of a person and the situation they're in. It is probably also the case that happier people are generally healthier people, but not necessarily because the happiness is producing the health, but rather there's other factors that are influencing both one's mental and physical well-being. And generally with optimism, people tend to have more positive perceptions of the world. They tend to have more positive expectations for the future. And they tend to have better self-regulation skills. And they tend to persist longer despite their challenges and setbacks. And so optimism can be predictive of better health, but it is not necessarily a simple direct cause. Terman evaluated stressed termites, such as children of divorce, and he found that there was a greater risk for observable behavior and adjustment problems in children whose parents were divorced. They also lacked social dependability, and they had greater levels of neuroticism. He found that their outcomes of family stress led them to smoking, drug use, and having poor psychological adjustment, so unhealthier behaviors, which played a role in their longevity. The predictors of their premature mortality were having undependability, impulsivity, and family instability. Features of mental stability are dependability, trust, and the lack of impulsivity. So these psychosocial factors can affect a whole host of health behaviors, such as drinking, smoking, exercise patterns, diet, etc. So when you put all of these together, it can explain a lot of associations between personality and longevity, because personality can influence certain health behaviors. Personality can interact with the environment, with stress, with parental divorce. And so all of these different factors can lead to certain situations that create unhealthy behaviors and influence a person's longevity. Tuberculosis was once thought to be the result of a weak or romantic personality, and it used to be seen as caused by character of the afflicted, meaning people believed that tuberculosis was caused by the patient. And so this viewpoint changed when the TB-causing tubercle bacillus was discovered. So this same misperception is currently applied to seriously ill patients, such as those with cancer and other diseases. And it tends to be that they are unfairly blamed for causing their illness. There are some reasons for why we tend to blame victims with a condition. One is that most of us have concrete concerns about our own health and mortality. The other is a cause and effect predictability. We have a desire for a predictable world, and we like to believe that if we work hard and take care of ourselves, things will work out reasonably well. When illness arises suddenly and progresses unpredictably, blaming somebody reestablishes this cause and effect predictability, and our own worldview is safe again. Mahatma Gandhi was one of the greatest workaholics of all time. He endured 2,300 days in prison, and he was not sickly despite this. He endured numerous self-imposed fasts, and he was not blindly optimistic. What defined his life was a commitment to principle. And as he aged, he grew more and more content with his life, but he remained humble. People who are constructively challenged find it easier to remain healthy. And so many publications are debating the question, why did this person become ill, how they can be treated. Little is asked, though, about how some people, despite their challenges, remain healthy and they don't get sick. A lot of personality researchers studying health have drawn much inspiration from the humanistic and existential approaches, which consider more positive aspects, and they focus on how a person remains healthy rather than what they did to get sick or how can they be treated. An analysis of business executives under stress in a large Midwestern firm examined psychological differences between those that became ill and those that did not. And over a period of 8 years, there were several key factors that emerged. These key factors were control, commitment, and challenge. So executives' feeling of control was a significant factor in terms of their health, and those that remained healthier did not feel powerless in the face of challenges, but they instead had this sense of personal perceived control over the situation. They had a sense of power, and they believed that challenging situations could be influenced by their personal efforts. The second was that people who remained healthy were more likely to be committed to things they felt were important and meaningful. So executives who were more committed to their work or their communities and families were less likely to become sick. The third one was that executives who remained healthy were responding to life with excitement and energy. So they welcomed change and innovation while remaining true to the fundamental life goals that they had already established. Subsequent research on personality and hardiness emphasizes turning stresses into growth and development. Social relationships and work situations are often challenging, but psychologically thriving individuals immerse themselves in these challenges. And so personality research emphasizes that remaining healthy is related to these three key attributes: control, commitment, and challenge. So perceived control is more likely to be associated with staying healthy under stressful situations, and turning stressful situations into a sense of power and an opportunity for change is also related to staying healthy. Trust is a motivation that's directly relevant to the self-healing personality. The self-healing personality is a cluster of health-promoting traits and emotional styles that promote a good person-environment fit, and these traits enhance flexibility in coping with stress and allow people to be more resilient to adversity. A lot of studies have shown that the characteristics of trusting people are that they're less likely to be unhappy, conflicted, and maladjusted. They are more dependable and they have more friends. They are not necessarily gullible, they are just less cynical, and they are healthier. And so there's evidence suggesting that trust and devotion are strongly linked to the healing personality. The humanistic and existential aspects of self-healing were found in Rogers' work. Roger called scientific attention to personal growth and fulfillment, and he proposed that each person has inherent a tendency to grow. A fully functioning person lives up to their potential. And his therapy involved helping patients clarify their feelings and helping people integrate their unique life experiences into their self-concept. So Rogers was one of the first to call scientific attention to personal growth and fulfillment, which is the joy of being alive. The fully functional person lives up to their potential and completely develops and uses their talents. The humanistic psychologist Maslow spent a good portion of his career focused on growth orientation. So the growth-oriented aspects of human beings. And he recognized that healthy people need to achieve balance in their basic biological needs. And once they do this, then they need to obtain affection and self-respect. And then finally, they achieve self-actualization. Features of self-actualized people are that they're spontaneous and creative. They tend to be good problem solvers. They have close relationships with others, and they have a playful sense of humor. And so as people become more self-actualized, they become more concerned with abstract issues of beauty, justice, and understanding. They become more ethical and more concerned with the harmony among members of the human race. And these characteristics of the self-healing personality are not merely the opposite of disease-prone characteristics as suspicious, bitter, cynicism, despair, and depression, but rather they are positive, meaningful motives, behaviors, and goals. Identity, purpose, and sense of coherence are also part of self-healing personalities that are related to mental and physical health. So there is evidence that individuals with personalities that seek out a sense of meaning or purpose in life and they're engaged fully in life have better mental and physical health. The Broaden and Build model proposes that positive emotions broaden people's modes of thinking and responding to situations. They also bring more positive actions to mind. People's sense of dignity are of psychological and ethical importance and also an aspect of health. And people that seek out a sense of meaning do have enhanced mental health. They also have better health behaviors and allow themselves to take control over certain situations. And so it goes back to this self-regulation, self-efficacy that's a part of self-healing. Coherence is people's confidence that the world is understandable, manageable, and meaningful. Salutogenesis is a general theory of how people stay healthy, and according to this approach, the world must not necessarily be controllable, but controlled or ordered in the grand scheme of things. So, for example, somebody that has a strong perception that they're carrying out God's purpose may have a high sense of coherence. So, this understanding of meaning and dignity is adds on an important twist to our comprehension of health promotion and maintenance. So, for self healing personalities, life matters, and in a person's own ways, individuals come to a view of life as ordered and clear rather than as chaotic and inexplainable.